Hello and welcome to Inside Katsina on Trust TV. I am Ibrahim Yusuf. Now, the prosperity and development of any society is directly associated with the overall health of its people. Therefore, the provision of efficient, affordable and available healthcare services should be on the front burner of priorities for any well-meaning government that has the interest of the people at heart. The Katsina State government, under the leadership of His Excellency Governor Aminu Bello Masari, is quick to identify the need to have a healthy populace and instituted moves to ensure that through the establishment of various agencies, strengthening existing ones, and having active collaboration with relevant stakeholders and associations with the aim of securing universal access to adequate and affordable healthcare in order to improve the health status of all residents of Katsina State. Now, one of such associations is the Nigerian Medical Association, which is a professional body for medical doctors in Nigeria. We had the pleasure of sitting down with Dr. Adamu Saminu Adamu, the chairman, Nigeria Medical Association, Katsina State branch, and he takes us through what the association is all about and some laudable achievements made by the Katsina State government in the health sector. Let's take a look.
Nigerian Medical Association is a professional body that is an umbrella body for all the doctors in the country. Every practicing medical practitioner of this country is a member of Nigerian Medical Association. It was founded since 1960 from the British Medical Association, and that's immediately after independence. So it was meant to be initially a professional body that is regulating the practices of medical practitioners, medical doctors in the country before it gave birth to Medical and Dental Council of Nigeria that now regulates the practice of doctors in the country. So it's the aim of the association is to foster unity and to maintain high standard of ethics in the practice of medicine and dentistry in the country. We have our national body, and then we have the branches, state branches in Katsina, Kano, Kaduna, and the rest. Each state has its own branch. We have the national president at the center, and then we have chairmen of various branches in each of the states, just like other professional bodies, like our sister professional bodies like the Nigerian Bar Association and the rest. Yes, as a professional body that look after the health of the populace, part of our aim is to see how we can maintain high standard in the quality of care that is being given to the populace generally. That's the main aim of our association, and then to foster unity among members. Part of what we do is to see that as we extend awareness to the general population, and then we most often than not do community outreach programs such as surgical camps, medical camps where we do surgeries, we do medical outreaches where we see outpatients and we give drugs to them, we pay visitation to orphanages, and then we also visit facilities to see what are the standard of practice that they are doing. And then as part of being a part of the MDCN monitoring committee, I'm the secretary of that committee in the state, and then also to look after the welfare of our members, because unfortunately when it was founded in the 1960s, the aim of the association is to see how we can maintain those standards, but unfortunately with the way things have evolved, and now part of the mandate of this association is to look after the welfare of our own members, to look after our remunerations, our other things that will affect our membership. So those are some of the few among what we do. Over the time, as I said, this association has been in existence since 1960. That's 63 years ago. It has been in existence since 63 years ago. So we have had various relationships with various governments, and sometimes it's a relationship that you want to say yes, and then sometimes it's a relationship that you pray never to have such experience in the future. So alhamdulillah, yes, we have so to say a good working relationship with the government, because what we are looking after is to see how we can improve the healthcare delivery in the state, so that we'll have a populace that can access a better healthcare services. NMA being a professional body is non-partisan, and we have tried as much as we can to see that we remain neutral in all policies of government. But alhamdulillah, since the inception of this government, we have to give them credit in what they have done, so to say, in terms of policy, in terms of equipping and renovating the hospitals, in terms of manpower. For example, there is the Katsina, that's the Katsina State Contributory Health Scheme, that was been idea of this government, and it has already been implemented, in which now it has reduced an in-pocket expenditure to the populace. I think in that aspect they have done very well. And then seeing the state primary health care under one roof, which is another policy of this administration, which they have done so also very well in that, in which they see that they now put all the primary health cares. Before they are under local government, each local government take care of its own primary health care, but now they have made it under one roof, in the sense that you will have a better administration and better policies that will go down to those primary health care, same as what was done at Subeb. And then you have the DMSA, that's Drug Management Agency. And then these are some of the policies that the government has brought, and I think they have done well in seeing and improving the healthcare delivery in the state. Vis-a-vis this, still there is still room for improvement. Even though it's time, we know you will have challenges along the way, and we hope the way the government has been listening, and we hope it will continue to listen to the stakeholders to see how they can improve in those aspects. And then the issue of hospitals, the government has tried so much to see that it has renovated most of the general hospitals in the state, and that is very commendable. And they have also made effort to see that they have brought equipment, even though you will always have challenges, and then it is always changing. The world is moving very fast. You will bring an equipment today and you realize that it's outdated tomorrow. So we hope the government will see into that, because it has renovated most of the general hospitals, Funtua, General Hospital Katsina, Kankia, Daura, Musawa, Malumfashi, Duzema, and I think that's very commendable. It is unheard of before to see that they have done that. So in terms of renovation of the hospitals, I think they have done well in that aspect. In terms of equipping the hospital, they have also tried as much as they can, but I think in that aspect, because the world is evolving very fast, medicine is developing very fast, just like other aspects of life, like technology. So I believe there is still room for improvements from the government, but by and large, I think it is a good development there. So what we mean, back then, before 2017, the primary health care facilities are being managed by their respective local governments council. Like for example, if you have Kankia local government or you have Funtua local government, they have their own facilities. So the administration of those facilities are directly under the purview of the local government. So what you usually have is you will have, and then you have some staffs that are from the State Primary Healthcare Development Agency, which is a state government agency that are being managing that hospitals, and then you will have some staffs from the local government. So those from the local government are receiving their salaries from the local government. Those from the agencies are receiving their salary from the state government. So you will now have a problem in terms of administration. You realize that people don't come to work because the person that is at the administrative level there, possibly the in charge, does not have a control over his subordinates that are working with the local government. That's one. And then two, you realize that most of those staffs are not even medically or health-wise qualified. They don't have any qualification that allows them to work in the hospitals, because they are cronies or wives or children of those people that have access to the government, they will be employed and they will be receiving salaries. You realize that you go to a facility, they will tell you we have 50 staffs, but you realize that those that are supposed to be working in that facility are not more than 5 or 2, or some of them may not even be coming to the work. Even if they are qualified, they are elsewhere working. So with the issue of the state primary health care under one roof, so you now have a central administration, so a staff can be posted from Kankia, and then that also reduce the cost on the wage bill of the state, because you now, so to say, like audited the number of staffs. Those that are not qualified to be there have been removed, and then others have been employed, so that the healthcare delivery will improve in those level of care. That's at the level of the primary health care.
The Katsina state government has indeed made giant strides in the area of improving healthcare delivery in the state, and the various policies and programs instituted in that regard are there for all to see. We'll take a break now, and when we return, Inside Katsina continues. Welcome back, and thanks for staying with us on Inside Katsina on Trust TV. We have been in conversation with Dr. Adamu Saminu Adamu, Chairman, Nigeria Medical Association, Katsina State Branch, and he has been taking us through what the association is all about and some of the laudable achievements made by the Katsina State government in the health sector. So we asked the question, how is the state government dealing with the issue of brain drain?
Currently, as I'm talking to you, there is a massive brain drain, internally and externally. And then manpower, human resources for health is not an easy thing. For you to have a qualified doctor, for example, it takes 8 years after he finished secondary school. He has to spend 6 years in medical school, 1 year's housemanship, and then 1 year service. That's barring all other circumstances. He has not repeated any class, he has not had any strike that will disrupt his academic pursuit during that time. So that's when you'll have a doctor. When you have nurses, so you realize that it's very difficult to have one doctor. So this government has done very well in seeing that they have started a medical school, because starting a medical school is very difficult, because the human resources that you need to do that is enormous. You realize that even the wage bill of those staff that you will employ for that medical school is huge. That's why you realize that it's very difficult to establish medical school. So it is quite commendable of this administration. We have now have a federal teaching hospital that has been training residents, and then we now have a medical school that has already have done an inception. But now it's not the medical school, it's not the number of doctors that you have, it's how do you retain them. Is the retention of that manpower that is the problem. Doctors, I usually said this, we are nomadics. We move to the greener pasture. It is a common knowledge that there is a massive brain drain. Doctors and other healthcare workers are leaving the country to the offshore. Here in Katsina, what we have is a massive brain drain. That is, doctors, other healthcare workers are leaving the services of the state either to other states or to the Federal Teaching Hospital or to National Obstetric Fistula Babariga or to the soon established Federal Medical Center Katsina. So even though that is a common knowledge, so I think in that aspect, if you ask me, the state government has done well when they come on board, but things have changed. I think they need to look in how to see that they can continue retaining their own doctors that they have trained, because if you look at it in that aspect, I think the state government is doing well to train doctors, to train nurses, but we have to do more to keep those doctors, those nurses, or those pharmacists. We shouldn't be training them for other people to benefit from what we have trained. We have spent a lot of money to train them. So, but if we cannot, because I'm a nomadic, if I have a greener pasture elsewhere, I will quickly move. So I cannot stay here and then and most of us are patriotic, are interested to see that we have stayed and the state to contribute. But the state government also needs to do more in terms of training and retraining of staffs, because we have now started, we have been doing residency training in Federal Teaching Hospital, so we have to start to now complement with residency training in the state as well, so that you can keep doctors. Not just the salary, the remunerations, no, even the training, because what is important for us is the training. I have to progress in my career. Or the second issue is the issue of my own remunerations. What do you pay me at the end of the day? If Federal Teaching Hospital is paying higher, I will move to Federal Teaching Hospital, because I'm still working for the state. I'm still working for the people of Katsina State. I did not go anywhere. It's just that I have a better working condition there. If you want to keep doctors in whatever facility, start a residency training program, because it's two things that attract doctors. It's the progression in their career, and then that's the first one, and that's also the second one. If I have to progress in my career, wherever I'm going to go that I will progress in my career, that's where I will be attracted to. So that's the first point, and that's also the second point. Then the third point is the issue of the wage bill. So if you now start a residency training in the state, what you will do is that I'm working for you, because the residency training is I'm working for you as a doctor. I give services, my own services, as I progress in my career. So meaning you will always have today, for example, I'm a house officer, just like a police officer or a military man. You know, you will start with, let's say, a corporal, what do you call them, a private, a corporal, an inspector, sergeant, inspector. So that's how we move up the cadre. So the services that a corporal will give you is not the same services that will be given to you by a sergeant, for example. So it's the same thing. The services that will be given to you by a house officer is not the same services as a medical officer. It's not the same service as a resident. It's not the same service as a senior resident, and it's not the same service as a consultant. So when you move through that, so you now improve, even the care given to the populace will improve, and then those doctors will remain. Because what are we going for? If I'm going to do residency training elsewhere, if I now stay in my own house, I will still prefer to stay in Katsina, do my residency training, serve my own people, and then I move up the ladder. So that's the aim of it. So you realize that if you start residency training, you'll not be losing your doctors. They will remain where they are. You will have, say for example, let me make an example with Federal Teaching Hospital. You have, for example, an O&G department that have, say, 40 doctors. Because some of them are under training. So imagine Ture or General Hospital, you have started that training. So you'll have similar number of those doctors that are there. So you realize that you will no longer have that chronic shortage that we have currently, because you have started residency training. So we have a lot of plans for the association. Let me mention but few. The main aim is to see how we can improve the welfare of our members, which we have started engaging the government. We are telling the government that if you cannot give more than what the federal institutions are given, give equal to that. So that will keep your doctors, and that will keep your nurses, that will keep your pharmacists. They will not be moving elsewhere, because it takes huge amount of money to train a doctor or to train a nurse. It will, for example, if you train a doctor in Nigeria, you spend roughly around 5 to 6 million naira for you to train a doctor in this country. That's a rough estimate that I'm giving you, and I think with inflation and the rest, that money is higher than that. If you train a doctor elsewhere, that's like 4 or 5 times or even 6 times that amount of money. And then the same thing with nurses, the same thing with pharmacists. Our courses are very expensive. So of what benefit will it be to you that you will train a doctor and then you cannot retain that person to work for you? So we have started engaging the government. Tell them that look at what you're doing. Give us better packages so that you can retain many of us. Because as I'm talking to you, we are leaving. As I said, we are non-partisan, and then there are a lot of things going on. We have been telling the government that look at it. We don't want to be seen being antagonistic, because what we look at is Katsina first. We want to see how we can help our people. So that's the issue of how we engage the government to see how we can improve on the packages of doctors so that you can retain them in the state and other healthcare givers generally. And then the other issues is, as a charitable association, we have a responsibility to our communities. We have been doing this over the past. We have organized community outreaches where we see surgical camps. I think the last one we did was in Kankia, where we operated over the last administration, my predecessor, where we operated over, I think, around 50 patients. We did surgeries to them, and we are planning that very soon we'll have our own outreaches, surgical outreaches and medical outreaches, where we'll see over 500,000, 2,000 patients in 1 year. And then we also engage secondary school students in career guidance and counseling. Yes, career, what do you call that one? Yeah, yes, guidance and counseling, to see how we can encourage them to go and read medicine, because we need doctors. As I'm talking to you today, one doctor see over 68,000 people in Katsina State. So that's huge. The WHO recommendation is that one doctor to 600 people, but in Katsina State is one doctor to about 68,000. If you take our number, you compare it with the population. So we encourage secondary school, and we organize quiz, which we are going to do. We are going to have our upcoming event. We'll organize quiz, guidance and counseling for secondary school students. We have been doing the inter-secondary school quiz competition, and then community outreaches, and then we'll see how we can improve on the welfare of our members. And then we have been engaging in radio programs, TV programs. Our doctors have been enlightening the populace on the issue of their health, so that we can improve on their health, on preventive issues and the rest. My expectation today is to see that Katsina State government commence residency training in the state. If they will just listen to that, if they will just do that, that will solve their human resources problem for the long term. Because if you will start residency training, you start training 10 gynecologists in a particular field, 10 gynecologists. So you have 10 extra doctors that are not going anywhere for the next 7 years. So if they can just start that, if they can listen to that, it's not much. It's something that you can do. It's something that you can achieve. Other states that are not up to Katsina have started that. And then with that, you will halt the brain drain that you have. At least the internal brain drain will be halted. So if I have a wish, that's my wish. And it's still achievable. This administration can do that. If they kickstart it, the next administration will just take over from there. And then the other issue is to see how they can improve on the welfare package generally on the healthcare workers, the doctors, the nurses, the pharmacists, the health attendants, any other person that works in the hospitals, because you need to motivate them. These are people that deals with the life of people. And then I always say this: if you have a governor that has access to a private jet that can just boom, tell the private jet on, switch. We're traveling to UK now. Sometimes you could have an emergency that cannot last more than 5 minutes. And that emergency can come at any time. It can come when you're in your own village. And that your own village, you refuse to equip it, to put proper equipment. The manpower is not there, and you could have that emergency there. And you will die there, just like any other person. So it has happened, and it has been happening. So if they can just listen, that look, the health is not something that you just politicize. It's something that you need to give priority to.
Affordable and qualitative healthcare for all is indeed one of the lofty dreams and priorities of the Aminu Bello Masari administration in Katsina State. And the state government is leaving no stone unturned in making that dream an obvious reality for all indigents and residents of Katsina State. Now, this is where we draw the curtain on this episode of Inside Katsina on Trust TV. Join us again next time when we shall shine the spotlight on another sector undergoing monumental changes under the restoration agenda of His Excellency Governor Aminu Bello Masari. Until then, I am Ibrahim Yusuf. Thanks for watching.